Welcome back, everybody, to the Therapist Confidential podcast. I'm your host, Travis Heath, and today I have the great pleasure of being joined by Judy Rubin. Some of you probably recognize the name if you know anything about art therapy, or even Mr. Rogers' Neighborhood, where she starred as the art lady. So today we'll talk about art therapy, creativity, and wherever else the conversation might take us. Judy, welcome. How are you doing?
I'm happy to talk to you, Travis. I'm doing fine.
I'm really happy to talk to you too. It's been a great treat learning about your life and your work. I'm wondering, for folks who might not be as familiar with your work, could you tell us a little bit about you, your work, and who you are?
Sure. I'm somebody who, as a child, did a lot of artwork. And when I was growing up, was sure I wanted to be an artist. I was the art editor of the yearbook and the school newspaper in high school. And then I majored in art at Wellesley. And because Wellesley was a little stuffy, I couldn't just be a studio art major. I had to take a lot of art history, which turned out to be a really good thing because I lived in New Jersey, not too far from New York City, lots of museums. Going to school at Wellesley was right near Boston. And so I could enjoy the art around me as well as refining my own skills. And what happened was that, yes, I wanted to be an artist. I had a lot of cousins who went to Pratt Institute in New York, and they became commercial artists. And then when I thought about it, I realized I wasn't good enough to really make it in the highly competitive world of the fine arts. And I didn't especially like the idea of commercial art, making art according to somebody else's idea. But I had discovered by then that I loved working with kids. And I'd been an arts and crafts counselor at a camp. And I thought, okay, I'll go and get some credentials so I can be a teacher.
Mhm.
So I got married shortly after I graduated college. My husband was going to Harvard, so I ended up, fortunately, being able to go to the Harvard School of Education. The thing that made the biggest impact on me, in addition to the practice teaching, which was probably the best part of the experience, was an advanced child development seminar. Now, I should back up and say that at Wellesley, I'd been in a child psych class where the teacher was doing an experiment using finger painting. And the idea was, did children from different socioeconomic groups make different kinds of finger paintings? And because she was in the middle of this experiment, which became pretty well known actually at the time, she held up the paintings in class and talked with great excitement about what she was discovering. And that's sort of resonated. Part of the class also required you to observe the children in the Wellesley preschool. And I found myself watching what they were doing with the art materials, probably more than what they were doing with block play or dramatic play, just because that was my area of interest. So I get to Harvard and I'm in this advanced seminar, and the teacher says, each of you can pick a topic and study whatever you want, and then you will lead a session and teach the rest of us about whatever it is you've studied. Well, I don't think anybody had ever said that. Wellesley had good teachers, but we never had that kind of freedom. So I started looking up everything I could find in the Harvard Library about the psychology of children's art. And so it was interesting. This is in the 1950s. Psychologists were very into diagnosing people through their drawings in those days. There was a lot of interest in projective drawings, but there were also people doing therapy using art. And it wasn't just children. It turned out they were also working with adults. Anyway, I was fascinated. And I ran across this term art therapy in some articles by a woman named Margaret Naumburg. And there was a book by a guy in England. Adrian Hill, an artist, he also used the term. And I thought, oh, that sounds really interesting. But of course, I'm going to be a teacher. And I should also say that in the 50s in the United States, art education was dominated by a guy named Victor Lowenfeld. And Victor Lowenfeld was a art educator, but he also had grown up in Vienna during the heyday of psychoanalysis and was very interested in the psychology of what was happening in art. And so his book became a kind of Bible for art educators. For many years, he was the dominant figure. And one of the chapters, which was later taken out, was therapeutic aspects of art education. So there was this sort of mental health component to being an art teacher that I found appealing, even though I wasn't a therapist. Anyway, I got out of school. I taught school in Cambridge. Would have been fired, but fortunately, we were moving to Pittsburgh. I would have been fired because there was no library in the school. So I brought books from home that I thought the kids might enjoy looking at when they came back from lunch. I made the mistake of bringing The Family of Man, which was a photographic exhibit at the Museum of Modern Art. And it was a beautiful book, marvelous photography, but some of the people didn't have clothes on.
Yeah.
Anyway, one of the kids picked up the book when they came back from lunch, and the entire afternoon was spent talking about a picture of a baby being born. This is a Catholic neighborhood in Cambridge. They brought up the stork, and I was trying to be diplomatic. I said, yes, the stork might have been involved. I went home and I told my husband how excited the children were about the whole idea of birth. And he said, you better be prepared. There's going to be some results. And sure enough, the next morning I went in, there was the principal, my supervisor, and two sets of angry parents asking to see the dirty book. So I said, oh, it's not a dirty book. It's an exhibit from the Museum of Modern Art. Anyway, they took one look and said, yes, it is. Fortunately, I had already said I was leaving and had gotten a job in Pittsburgh. So they said we would have to fire you if you weren't leaving.
I'm interested in that story because, I mean, you said, you were kind of naive, but I'm also wondering if you kind of push the boundaries of things sometimes. Is that fair to say?
Yeah. And I wasn't even aware that I was offending people. And
Mm.
as a matter of fact, I remember one of the teachers wanted me to use some handouts that they had with outlines, you know, uh, coloring book pages. And I said, no, I want the kids to do their own work. But I had offended her by not using the handout that she had offered me. And I had offended people by staying after school to fiddle around in the classroom when other teachers raced the kids out the door and, and doing a lot of singing. I also like music, and the kids like to sing. So I added things to the curriculum and offended people. So yeah, you're right. I think a little bit rebellious, but I wasn't conscious of
Yeah. It's not like you were being rebellious to try and be rebellious, but there's something in your spirit there where it's feeling like the way things had always been done or were supposed to be done. It's like you saw some alternatives, some other ways that maybe this could be done. And I'm thinking, to do what you did in the field with art therapy, I mean, I know that it was already a thing in the 50s, but I feel like, and you can correct me if I'm wrong, I feel like it was kind of on the periphery. I mean, like you said, yes, drawings were used for diagnostic purposes, it's my understanding anyways, as you were saying, but like the idea of art therapy, I'm imagining like you have to think a little bit differently to sort of push that forward in the ways you did. Is that fair?
yeah, I think that's true, and I think that might be one of the reasons that when I stumbled into it, it appealed to me so much because I did end up teaching in Pittsburgh too, and also was called into the principal's office, and she said, "I've heard from the other teachers, your children say you don't use the paddle." And I said, "Well, I don't need to. Children like art. They behave very well. There's really been no need." I didn't say I don't believe in corporal punishment, but I didn't. But that wasn't why I didn't use it, I just didn't need to. So I think it was at that point that and I also got in trouble. My first supervisor was Andy Warhol's teacher. Andy Warhol grew up in Pittsburgh, and he went to classes at the Carnegie Museum, and Joe Fitzpatrick was my supervisor, very nice guy. But he walked into my classroom once and was upset because I was showing slides, and that wasn't in the curriculum. And I'd gone to the Carnegie Museum and gotten some slides to inspire the kids. So yes. So I was getting in trouble for doing things that were somehow deviant, but they made sense to me. So I decided, okay, teaching in the late 50s is not for me. And then art therapy was something I really stumbled into because I admired the artwork of one of my friend's children on the wall, and my friend said, "Oh, they're studying children's art at the place she goes to preschool." And I said, "Oh, I'm really interested in studying children's art." She said, "They're doing longitudinal studies. Maybe you could volunteer." So I went to see this woman who was Margaret McFarland, who was the director of the preschool. And at the end of our meeting, she said, "We'd like you to work with us." It was run by the Child Development Department at Pitt. And we'd like you to work in the after-school groups with the school-age kids doing art. We'd also like you to do art therapy at the hospital because, believe it or not, in 1963, the Child Development Department at the University of Pittsburgh was in child psychiatry. And psychiatry at that time was dominated by psychoanalysts. This place, this preschool, had been founded by Eric Erikson and Ben Spock, two of the most well-known child development and pediatrician people. Anyway, that's where I met Fred. So I said, "I don't know. I can't do art therapy. I'm not a therapist." And Margaret McFarland, who was Fred Rogers' mentor as well, said, "Oh, don't worry. I'll supervise you. I'm a clinical child psychologist." And so, again, quite naively, I went off to work with these children with childhood schizophrenia who were in long-term care in a psychiatric hospital.
Wow.
And that's when I fell in love with art therapy.
Can you talk some more about what you were noticing in terms of art therapy for those children? Because boy, there are a lot of stories even today told about childhood schizophrenia, right? And so I'm curious what you were noticing in terms of the effects of art therapy.
It was amazing. Uh, it was so fascinating. I mean, I had liked teaching normal children, um, but these kids were so different. Today, a lot of them would be diagnosed as being on the autistic spectrum.
Yeah.
Then they were labeled with this one label, but they were quite different one from another. I literally saw each kid as long as they could tolerate, one after another. I went there one day a week and would present the art, and each one was different. Many of them didn't have language, or if they did, it was quite garbled. They had many other disabilities besides their mental confusion. And what was fascinating was how each of them individually used the opportunity, which I presented sort of, here's the material, and here I am, and here's an easel and a table, and you can use paint or clay or whatever you want. And they did whatever they wanted, work where they wanted. Because I had no training, I didn't say very much, but they said a lot with their artwork, and
Mm.
so much so that at a certain point, Eric Erikson, who had founded Arsenal, the preschool where Fred Rogers and I worked, he came every year to do a grand rounds. And one of the kids that I was seeing was almost nonverbal. She had some language, and she also had some orthopedic handicaps. She was quite isolated, didn't interact with the other children, but she loved art, and she was articulate in her art. And I'd been sharing the artwork with the other people at Arsenal as well as at the hospital, so they decided that we would present that kid. to Erickson. So everybody worked with the kids, grand rounds, the psychiatrist, the teacher, the OT, everybody worked with the kid, reported on what was going on. And I showed slides of the artwork and just described what was happening. And then I went out for drinks with Erickson and the chairman of the department. And I said, Professor Erickson, I don't know what I'm doing. I mean, I'm flying by the seat of my pants.
Yeah.
I know something wonderful is happening. She was expressing very articulate, hostile images as well as loving ones. But I feel I need to learn something to understand what's happening. And I won't try to do his Austrian accent, but he basically said, do not do anything to ruin your intuitive ability to connect. Don't study anything. Just keep on doing what you're doing, which, I mean, he was a genius. He didn't go to college, but anyway, later I decided I was going to study, but
Wow, that is a story. So you've got Eric Erickson, who, prominent at the time in the field, and it's probably become even more prominent as he's in every intro to psych textbook anywhere, right? And then here you are saying like, well, I don't know what I'm doing. And in a way, he's saying to you, but I think you do know. There's something intuitive about what you're doing. And I can see both sides of that, because I imagine being in your shoes and I'd be like, I don't know I can tell something is occurring, like something is afoot, but I don't know what I'm doing. But he notices something intuitively that's happening. And here you are sharing this story. I'm wondering, is that like a foundational sort of moment for you when you look back on your career and keeping you moving forward with this work?
I think so. I mean, it was very affirming on the one hand.
Yeah.
It kept me from studying anything else for a few years. But I think the work with the kids was affirming, not just because of Erickson, but really because of what they were doing.
Mm,
Every single one of them used the opportunity to create with art materials in a way that was therapeutic for them, and it was quite varied. And that's what was fascinating. The work was so much more challenging than teaching. I mean, teaching is certainly challenging, but
yeah.
it was a different kind of challenge. And I think I felt like I was using all of myself in a way that I hadn't. And I think the other thing is that the people in the child development department, the program, the people I met with every week as a staff at Arsenal, they were supportive. What I was doing with the kids in the after school group or with the kids at the hospital was approved of by them, as opposed to my experiences in the schools where I'd been out of step. So I think that was another reason why it was such a congenial milieu for me to sort of grow in.
So there you are in the early days. You don't know really what's happening, but something's happening. As time went by, how did you start to understand what was actually happening?
There was no formal training at that point. There was a course at the new school and a course at NYU, and that was about it. But Margaret Namberg and Edith Kramer was also a refugee like Lohenfeld from the Nazis, and she was a very important early art therapist. They both lived in New York, and my parents lived in New York. And so I wrote to both of them, and I asked if I could meet with them and get their guidance. What should I do to become an art therapist? Each had thought she had invented the field. They were somewhat rivalrous at the time,
Mhm.
and each one told me not to meet with the other.
Oh gosh.
But I said, "Well, I'm sorry. I don't have much to work with, so I'm going to." I was open about it. And I learned a lot from each of them, and I would meet with them when I would go to New York. One of the things both of them said was, "You need to get into therapy yourself because you have to understand yourself if you're gonna be a really good therapist," and I had never had any psychotherapy, so that was something I took to heart, and they were basically pretty affirming actually of my intuitive approach, so that was nice. And I also got to go to their classes and meet with them and observe. observed Kramer working in a couple of places at the Guild for the Blind and also at Jacobi Hospitals. And I went to their classes at the new schools. I was lucky that my folks lived in the right city and I could consult with the founders of art therapy in America. And then there was another one, Eleanor Ullman, who Margaret told me about, who had just started a journal called the Bulletin of Art Therapy. So I wrote to her, and she was supportive. So these were individuals. The association didn't form until 1969, and we're talking 63, 64, 65. So there really wasn't a field or a profession of art therapy yet. And I think, honestly, that's probably one reason why I've enjoyed it so much, because I entered it when it wasn't formed, and it was a time when you could sort of make it up as you went along and try to think about what kind of standard. I got involved in this professional association, got on the board, was president, but I was really excited about the work itself.
Yeah, I mean, almost like art itself, you had to help create this field. I mean, there were some people that were already doing the work, I understand, but it wasn't a formalized thing yet. So you had a hand in helping to create this. And this idea of intuitive approach, I want to understand that more. Like, and by the way, psychotherapy.net will have some of your videos and people could watch them and see this for themselves. But just in our conversation today, if you, over the years, as you came to continue to cultivate this intuitive approach, what did that actually look like? What were you actually doing?
It's a good question. When I finally got around to studying something, it was psychoanalysis, which really appealed to me because it was sort of wide open. It's a very creative thing to just lay on the couch and say whatever comes into your mind for an hour, 5 days a week. Before I applied to the Analytic Institute, my therapist, she said, "You should try it before you apply." So I did. I went and tried somebody's couch for a few months, and I really loved it. It was fascinating, just following wherever your mind would go. The freedom is just amazing, and, of course, I would have a lot of visual images, and the reason I chose psychoanalysis rather than a PhD in clinical psych was because I realized that the best supervisors I had were child analysts, and I thought they must know something. So I ended up studying that, and then got a PhD for the sake of PhD.
So you're studying psychoanalysis, and then I'm imagining, tell me if I have this wrong, that then you're connecting that with your work as an art therapist. Tell me about that connection and how that integration went.
They were not exactly eager for me to, well, what I should back up. In those days, if you were not a medical person, you couldn't get into a regular analytic institute.
Mhm.
To get uh, people to write something saying I was going to make an impact in my field. But I'd been to the first meeting of the American Art Therapy Association and was very inspired and excited by 100 people, but it was all the people who individually had sort of discovered this thing of combining art with psychology on their own. And so I ended up so when you study psychoanalysis, it's tripartite. You have to have your own analysis, which was different from my therapy. I couldn't go to my old therapist. I had to go to a training analyst 5 days a week on the couch. Then when you're analyzed enough, you're allowed to start classes, which you do a lot of reading, basically following the development of Freud's thought, which is actually fascinating because he changed his mind a lot over his lifetime. And then the medical people would get cases, but being non-medical, I had to get a waiver to see patients. So I did get a waiver, and you had to see adults first. I had to do adult cases before I could apply for the child analytic program. Ended up seeing 3 adults and 3 children, supervised. The adults were 5 times a week, the kids were 4 times a week, and I went to a supervisor for each of them every week. So it was very, very detailed, close supervision. It was fantastic training, I have to say. It was just terrific.
I'm struck by the amount that you had to go through just to be able to do the training too, you know? Like, this wasn't supposed to be training that would be offered to you.
It's true. Well, it was gradual. I started out just doing the analysis and going to the classes, and then I guess I got really curious about what it was like to be on the other side of the couch because I was fascinated, like I said, by the process of free association myself. In answer to your question about the how was art integrated, well, I was already doing art therapy at the Child Guidance Center, and so the children who came for analysis walked into the same room that anybody else did with a lot of art supplies and puppets and music and other stimuli around, and the only difference was that I saw them 4 times a week, so it was very intensive, and I tried to behave in as analytic a way as possible, which I think I did generally intuitively anyway, sort of reflecting and not interpreting. So the art was part of the child work. I asked for permission to include art with the adults. So 2 of my supervisors said yes. One woman would make art at home and bring it in, and we would look at it while she was on the couch. But she was very intellectual and verbal, so it really was a brand new mode of understanding for her. It was quite exciting. I tried it out with people doing stuff on the couch, using plasticine, making little sculptures or drawing on the pad. This is in sort of orthodox analysis, I'm behind them. So I experimented. Yeah.
Oh, that's so interesting to me. What were you noticing in these experiments? What was happening?
Well, I mean, it was the same reason why art therapy is, I think, so wonderful and amazing because people could, if you're smart and you are pretty good with words, you can talk a good line. And a lot of my patients were like that. I was required to do low fee analyses. So they tended to be people who were studying to be psychologists or something like that. One patient was a regular human, not in the mental health field. So they were pretty verbal. And as with adult art therapy patients, when you express yourself nonverbally, it's really different from when you try to put something into words. They discovered things that they couldn't have discovered in the same way. That's awfully general, but it was really powerful. It added a dimension. The other thing was I decided to do an experiment with an artist friend, trying to see if you did free association in art images. Like you would draw something,
Uh, yeah.
turn it over, what comes next? What comes next? Don't think about it, just do it. So we did a course where people came, I think it was 5 weeks, did drawing, painting, clay, and then I interviewed everybody afterward, and it's a really interesting experience. I used it in workshops afterward. It's powerful because it's totally nonverbal. Anyway, so that's a lot. I gave you a lot of detail.
No, I love that. I'm interested in this difference between the verbal and the nonverbal. So, like, when they're creating something that's nonverbal, does it stay nonverbal and there's a felt sense in creating it and that's what's therapeutic, or do words start getting added to that which was originally nonverbal, if that makes sense?
People sort of fell into one of 2 groups, and that's true with children as well as adults. And that is, for some people, they had to stop verbalizing in order to really get involved in the artwork, and they couldn't talk. They didn't wanna talk while they were working, whereas other people, it seemed to free them up to talk more. And I never did a study to figure out what differentiated these 2 populations, but it was pretty dramatic.
Yeah, that's really interesting. And either way, then the outcome's useful because if they can put words to it, great. They weren't able to put words to it previously, and if they can't, well, there's still something happening.
Right. Yeah, I mean, but some people it's pretty obvious, like if they're using contact media, clay or finger paint, something where you're actually touching the material as opposed to paint where you have the brush between you and the paint. My husband ended up in the Department of Speech and Theater Arts, and he used to send stutterers for art therapy because while they were working with contact material, the stuttering disappeared.
Oh, interesting.
It was really fascinating.
Gosh, how do you make sense of that? What do you think's happening?
Something going on neurologically, I don't know what, but it was fairly dramatic, and I can think of a lot of kids and adults who came for art therapy and who were pretty heavy stutterers. It was a serious disability, and yet somehow when they were working with materials, especially contact materials seemed to be the most powerful, they were able. It's it makes me think, I mean, this is not the same thing, but when people have strokes and they can't talk, they can still sing.
Mm, interesting.
There's something going on neurologically that makes it possible to access speech in a different way. I don't know the explanation. I just know it was wonderful to watch. Of course, it doesn't last, so but at least it gives them the experience of being fluent.
Yeah, yeah. Well, and it makes sense to me that it wouldn't last. And in some ways, that's not even so much the point, is that it's possible. It provides a window of time where this can happen. And I think it speaks to, the power of art in that way. And I'm wondering if you have any other examples that come to mind of, like, where something happened and it surprised you, or you were in awe of it, or you couldn't believe it. Does anything else come to mind about your work with art and people?
I think, what popped into my head was a woman who had been in therapy for most of her adult life. She'd been very depressed and suicidal, hospitalized many times, and she was referred by her therapist, who she'd been seeing for quite a while, a guy I knew through professional contacts, and he continued to work with her, but he thought that art might help her. And what we discovered when she was using the art materials was that she was had a dissociative identity disorder, which hadn't manifested itself previously with all the years of therapy. All that showed was the depression and the suicidality and the self-harm. And while she was using the art material, she would go into an altered state. This didn't happen right away. It happened after we developed, a good trusting relationship. But it was visible. And then she would work on whatever she was working on. She preferred clay for a long time. And
Mhm.
I would be literally across from her, but she wouldn't talk. But after the work was done, then she would sort of shift back into her, I guess, the social whatever, and we would look together at what she had made, and she would talk about it. And sometimes when she was talking about it, she would shift back into the state she was in when she made it, so the voice would be a little different. It was
Yes.
really fascinating. I worked with her for a number of years, and I had the thought that everybody who's a therapist should really be required to work with somebody with this disorder, because you really understand internal conflict in a way that you don't. There were the little children parts of her that were frightened, and then there were the angry parts of her that wanted to hurt her, and they were in overt conflict.
Wow.
Yeah.
As you're talking about this, I'm also thinking about, and this is from someone who's not an art therapist, right? Who's on the periphery of that. The way that I hear art therapy talked about these days is almost exclusively around it being for children. And I'm wondering if you can say something, and you're shaking your head vehemently. No, I'm wondering if you can say something about that sort of assumption.
That was that I'm sorry to hear it's still there. It certainly was the assumption early on. And it is true that both Namberg and Kramer, who were the 2 major writers in America, major writers in the field, did their work with children. But No, absolutely not. But that's a misconception. I bet you if you look at the populations that art therapists work with, it's probably a minority that work with kids. But I think for many adults, using art materials is quite threatening and uncomfortable. And so working with adults, you sort of have to sell it. Like, this is I wish you would try this, even if you don't like it, because I kinda think it'll help us get to some things that we can't get to by just talking, and finding ways to help people try it out without being too self-conscious.
Yeah, I'll own up to this. I actually have a friend of mine who, writes poetry. She's a therapist, and she at the end of each session, she writes a poem about the major themes, and I'm always like, "I could never write a poem. I'm not poetic." And she goes, "Oh, you're absolutely poetic." And I feel like I do the same thing with art, just to be 100% honest with you. I'd be like, "Oh, I'm not artistic. I can't do that." I mean, I'd be like, "Oh, I'm sure that's great for people, but not me, because I'm not artistic." And I'm wondering how you approach that? Because I'm hearing that, like, maybe sometimes it's a harder sell with adults.
Oh, yeah, for sure. I think it's funny, one of the books I wrote, I got in a lot of trouble. I have written a bunch of books too, because I guess as I was discovering things, the first meeting at the Art Therapy Association, I talked about a group I had done with a social worker where she saw the mothers and I saw the kids, and then we combined the groups and did art with them together and then split, and it was really powerful. So the editor of the journal said, "Could you write that up?" So that was my introduction to academic writing. It was also a way of sort of thinking things through for myself, figuring stuff out. But anyway, the book I got in trouble for, which was 2005, was for non-art therapists to help them find comfortable ways to invite people to use art materials. That was considered very, disloyal. Some art therapists I mean, obviously, art therapists do not own art any more than they own therapy. And also, there are a lot of ways of helping people fiddle around with materials, sort of play with pipe cleaners even or something, where they're not worrying about making a representational image. Anyway, yes, that's one of the things that I think most art therapists have learned to do, which is to help people who say, I can't do a thing, I'm not artistic, and find out that it can be really helpful.
Gosh, I have so many more questions I could ask about that. I wanna transition just a couple of other areas before we finish today. So, the company that you had founded was Expressive Media, if I'm remembering correct, in the mid-80s. And you were creating films about expressive arts therapy. And obviously at psychotherapy.net, this interests us, and your library gets to live on through psychotherapy.net, which is amazing. But I want to learn more about what initially drew you to this idea to film art therapy and why you believe that was important.
I was telling Fred Rogers about some multiply disabled children I was working with at the School for the Blind, and I said, "Nobody's ever gonna believe how creative these kids are, even the people at the school." These were the newly rescued children because of advances in NICU care who were living with blindness and other disabilities, and the art teacher at the school said, "Oh, you shouldn't work with those kids. They'll have the materials in their mouth, they'll be throwing stuff all over the floor." Well, it turned out they were amazingly creative, and I said to Fred, "Nobody's gonna believe me." And, we sort of tailored grouping the kids and how to approach them based on an assessment that I invented for each kid. And it was a pilot program. And he said, "Well, you have to make a film." And I said, "Well, I don't know how to make a film." He said, "Well, you must know somebody with a camera." And I said, "Well, the people at Children's Hospital have been taking pictures of artwork so I can give lectures. I'll call them." So I called them, and the guy said, "Oh my gosh, we just bought a 16 millimeter camera. It's black and white. It doesn't have sound, but we'd love to go film at the School for the Blind." And so I made this first film, basically to show what kids were capable of, kids who people had written off. That's a lot of what happened in the early days, especially of art therapy, was people who in different classifications who people didn't think had any creative spark. And it was just a matter of figuring out how to reach them.
I noticed kind of a theme here at various points in your life where you're kind of not exactly sure how to do things or what's happening, but you go forward anyway. Like early on, you're talking about in the classroom and then with art therapy, and the conversation with Eric Snow, you're like, I don't exactly know what I'm doing. And even with filmmaking. So there's this kind of spirit of like, you don't know exactly what you're doing, but you kind of figure it out as you go.
Yeah, I think I like that. I think I enjoy that. And I think that's part of why I enjoyed being a therapist. But the reason I got into film was to show because you can't really understand something like art therapy or drama therapy or dance therapy or without either participating or seeing it in action. Writing about it just doesn't do it. There's so much that goes on that can't be described in words.
I'm wondering about, and I'm not talking about art therapy, although I'm afraid this may come into art therapy in some ways too, but just therapy in general, this idea of like manualized treatments and following a script. I'm wondering how, I can see from your reaction, not your favorite. Wondering if you could talk some about what you make of that movement in the field.
I'm sorry to say I don't have a lot of respect for it. I can understand people's hunger. In the field of art therapy, there's always been a great hunger for dictionaries and recipes and manualized directives. Directives, which I find abhorrent, is now a popular term among art therapists. They want to know what to do with this group of people or this kind of person. To me, that's so antithetical to what therapy ought to be about, which is meeting the person where they are and finding out what they need. But there is a hunger for that. And a lot of art therapists have studied a lot of manualized approaches, EMDR, CBT, you name it.
If someone came to you and was like, "Hey, that's great that you use this intuitive approach and all, but like I'm scared to do that. I need a manualized approach to art therapy." What might you say to them?
Well, I'd say I think you're not going to help people as much that way. Really have to meet people where they are, and meeting people where they are requires finding out who they are, and that doesn't happen with a manual, in my opinion.
It feels to me like, and my bias lays in this direction too, but it feels to me like for you, the very act of therapy is artistic.
Yes, I think so. I think it's really creative work, unlike anything else I've ever done, including making films and writing books. It calls on everything I have. Like, I have to be, like, totally there, totally present. I mean, it sounds so corny, but I think you know what I mean. It's
Yeah.
not something you can just check off a checklist, and I think it's too bad that people in the field of art therapy are still quite insecure. It is a confusing field because it's hybrid. They're not quite artists, they're not quite therapists. They don't get paid as much as other therapists, so there's some resentment and insecurity, and I don't think we've found our identity yet, which is too bad. I think we're still working on it, I hope. In fact, I'm working on a film right now. I'm not making it. I just somebody else is doing the editing to show what really goes on.
I'm very much biased towards that way of teaching and learning, that show beats tell. I mean, there are times to tell, but the more that we can show our work. Also, I recognize there's a lot of vulnerability in that for people to show their work. So I appreciate what it asks of people to do, and I think it's the best way for us to teach and learn that I've found in our field anyways. Now I've got a couple of more questions I wanna ask you, and then I'll wrap up. So for me, knowing that you were the art lady, in quotes, the art lady in Mister Rogers' Neighborhood. I watched Mister Rogers' Neighborhood growing up. You mentioned Fred's name a few times during the course of our conversation. I'm wondering if you can talk some about your role on that show and also just the show overall and kind of its how it's located historically within the culture.
Yeah, just yesterday, I met with a woman from England who was born in Italy who's doing her doctoral thesis on Margaret McFarland and Fred Rogers and the Arsenal Family and Children's Center, which is the milieu out of which that show grew. I think it's one of the most wonderful things that ever happened. I I was lucky to meet him. As I said, Margaret, my mentor, was his mentor too, and she said, "He's in Canada now, but when he comes back, you guys have to meet each other, you'll like each other." And we did, and I watched him work with the kids through the one-way observation mirror, and he watched me work with the kids through the one-way observation, and he said, "I'd like you to be on my program." And I said, "Well, no, I can't. I'm gonna be taking some time off. I'm having another baby, and I wanna nurse him and or her, um, and I'm not a performer." And he said, "Well, that's why I want you, because 'cause you're not a performer." And I said, "Well, what would it involve?" He said, "Oh, I would just send you a script, and you would figure out what to do with kids, and you'd come in, and we'd talk about what they did, and then you and I would play." And I said, "Well, no, I don't think so." Anyway, fast forward, I don't know, 8 months later, I'm just had another baby, and I get 6 scripts in the mail. He's ready to start. This was the first 3 years of the show, which unfortunately were black and white. They were scripts, and then there would be 6 or 7 minutes. Mrs. Rubin comes, Mrs. Rubin leaves. So I had to figure out, given whatever the theme was of the script, what I could do with kids that would have something to do with what was happening on the program.
Yeah.
Had to be kids between 3 and 7, roughly, those are the age range he thought he was reaching. So I had my children and the neighborhood children, and we did something with materials. He also, interestingly enough, he said, "Use materials from around the home as much as you can, not fancy art supplies, so other people can do it." So there's a lot of work with vegetables, and when I got the scripts, I did call him and say, Didn't you hear me? I'm really not interested." He said, "Just try it once. If you don't like it, okay." So I said, "That's fair." So I forget what the first show was, but anyway, it was the first week or second week, and I did it, and it was fun, and it was fun doing the stuff with the kids at home, and because I wasn't working, I think I was doing a little teaching maybe and consulting, but anyway, it was fun. What I think sold me on it, well, Fred was a marvelous human being to work with and for, and he was so creative and so kind and so brilliant, really, that I appreciated that part of it, working with somebody that inspiring. But also, I'd go to the supermarket and somebody would come up and say, "Oh, we did that thing that you did with on the show last week. I did that with my kids." And I thought, "Oh, well, we're reaching a lot more people than I reach when I go give a talk at a preschool or something." So
Mhm.
that sort of had an impact. I didn't
Yeah.
answer the question about where its role in the culture, but I wish we had Fred Rogers right now.
Mm. Yeah. A From where I sit on the outside, it feels like that's of course, things change over time and all of that, but what I mean is just that feels like a time that existed that I can't access again now, you know? And even as you're telling the story today, it's like and I've heard no one as close as you are to him, but I had heard, this guy's legit, like, he actually is who he is. He's not playing an act, right? And so there's something about that, the authenticity of it, and yeah, it does feel like we're in a time where things are so divisive and it just I don't know, it's like a relic of the past that feels like it can't be recreated. I don't know that that's true. Maybe it can be in some way, or maybe it can be channeled in a modern context, but yeah, to me, it just feels like a bygone era, and and it's more, that sort of spirit and energy is more needed now than maybe ever.
Well, he was a very remarkable human being. He was a minister and a musician, and he wrote the whole show himself. He was all the puppets.
Right, right.
I mean, he was multi-talented, but you're right. What you saw was the real guy. He was very authentic and down to earth and lovable. And I did make a film about his teachings after he died, Lessons from Mr. Rogers' Neighborhood, because it was for
Yeah.
a symposium on art and psychoanalysis. And I thought he did the best job of taking psychoanalytic concepts and translating them into ways that regular people could understand. Just brilliant.
Yeah, that there you're right, there's a brilliance in that. That's no small feat to do that.
Yeah.
Yeah. To take a language that really wasn't made for most people. I mean, the language of psychoanalysis and of psychotherapy, psychology, psychiatry, this is a privileged language that is for the elites who studied this, and it's not supposed to be accessible to the general populace. So to be able to take that and translate it in that way, there's a brilliance in that. All right, I want to ask you this question in closing. I could keep going with you, but I want to be respectful of your time here. So, when you look into the future and you spent these decades working in this field and pushing it forward, and we've reflected on just some of your contributions, but there are many, many more out there that people can go find on the internet quite readily. But when you look at the future of the field, where would you want to see it go? Are you hopeful?
Yes, with some anxiety, because as I said, the hunger for easy answers and recipes and cookbooks is still there, which has been there from the beginning. The insecurity is still there. But the good news is that the arts and healing are finally being recognized by people outside of the mental health world. For example, the World Health Organization and the NeuroArts Blueprint, and there's all kinds of activity now around the simple notion that people feel better when they listen to music or go to a museum or dance, which we've always known, but now people are social prescribing. They're prescribing art classes. So the understanding in society that the arts are good for people has finally become, I don't know, popular. And I think it's partly because of fields like art and music and drama therapy that this has happened. I kind of imagine that it would have been harder to get there without people demonstrating that elderly people use less medication when they went to art classes or sang in choruses than when they didn't. That's hopeful. Now, to educate people to the very special space that is related, sort of on a continuum, to these arts and healthcare, arts and society, arts in the community. I mean, there's an awful young art therapists are all idealists and they all want to go out and save the world. And a lot of them do go to refugee camps where of course it's very helpful for people of all ages to be able to express themselves. So the community art therapy movement is growing very fast because of our mixed up world and the many needs. I think that's wonderful. I don't think it's the same as what goes on in the kind of therapy session we've been talking about, where it's you and somebody else or you and a family, and you're really trying to help people change.
Sorry, I lied. One more question. So imagine and I'm sure you've had these very conversations, but imagine you're speaking with a young therapist who's coming up who wants to do art therapy. What advice would you give them?
I keep thinking of Polonius and Hamlet. To thine own self be true. Trust yourself and learn from whoever you're working with. I think you learn as much from the people you're working with or the place you're working as you do from any textbook or teacher or supervisor. And know yourself as well as you can. That's really important.
This has been a pleasure. The hour flew by. I appreciate you making the time, Judy, and I'm hopeful that you and I can converse again soon.
Yeah, me too. I hope I haven't blabbed too much.
No, well, this is why you're here. We we wanted to hear you blabbing about all of these bits of wisdom that you've gained over the years, and so I guess that's not blabbing though. It's something entirely different. So no, no blabbing. Just inspiring conversation, good stories, and much appreciation for you taking the time. Thank you.
Well, thank you for asking good questions. And I think the other thing I'd say to a young therapist,
Mm.
when in doubt, don't.
When in doubt, don't. Words to live by. Thanks, Judy.
Thank you, Travis. It's been fun.